Hello, I'm Dr. Ryan Stratford. I'm a urogynecologist at the Women's Center, and as a urogynecologist, I get asked very frequently, how can I help treat urinary incontinence or leakage of urine without desiring? This is a very common problem. In fact, about 1 in 3 women in their lifetime will have some intervention to treat urinary incontinence. The most common type of urinary incontinence is called stress urinary incontinence. It occurs when you cough, sneeze, laugh, or exercise. These types of leaks are due to lack of support to the urethra. And the most common cause of this is lack of support as a result of injuries from childbearing. Let me show you what that looks like. In this diagram, you can see where the bladder is located here and where the urethra is located. That's the outlet to the bladder. If there's normal support to the urethra, then when someone coughs or sneezes, it won't allow for leakage to occur. However, if that support's broken down as a result of childbirth injury, then during a cough or sneeze or pressure event, leaks will occur. And they'll usually be small amounts, but they'll happen on a frequent basis, and it can be very bothersome. Treatment then entails trying to help support that urethra. There are many conservative ways of treating this condition. The most common way that women are taught or are encouraged to do to help treat this is doing exercises of their pelvic muscles, or called pelvic floor exercises, sometimes called Kegel exercises. Here's a model of the pelvis. You can see there are multiple muscles in the pelvis, and they work as a team. The muscles around the urethra of the bladder or of the rectum are called sphincter muscles. They're circular muscles that squeeze those outlets. If that muscle is strong, then the squeeze pressure is greater and it prevents leakage. So strengthening these muscles by doing exercises on a daily basis and trying to contract and relax those muscles can help reduce leakage. If that's not successful, then you can place something in the vagina to support the urethra. Over the counter, you can purchase a tampon-like device called Poise Impressa that's placed in the vagina and supports the urethra and can be used during an activity, particularly if you know when you're going to have a leak event. So as an example, going to the gym, you could place this inside and use it while you're in the gym and then remove it once you're completed with your activity, and you won't have leaks during that activity. If, however, leaking occurs without necessarily knowing when it will happen, for instance, it happens every time I cough, doctor, or I'm struggling without knowing when I'm going to have the leaks, then wearing something that supports the urethra all the time might be a good option. They developed pessaries years ago for support of the vagina for prolapse, but they can also be used for incontinence. Here's a pessary. It folds and very easily slides into the vaginal canal, and then once open, it supports the urethra to prevent leakage. These have been around for a long time and can be worn for many days, even weeks, and then removed and cleaned and placed back in so they're constantly providing support. There's also a device that's been more recently developed just for urinary incontinence called Uresta. And you can see that it's shaped a little bit differently, but goes in a similar way into the vagina, supports the urethra, and prevents leakage. Once again, made with material that's safe to have internally, will not cause infection, and can be used for many, many days and then cleaned with soap and water and replaced. If that doesn't work, if you've tried doing exercises, you've tried wearing something and you're still having leakage, or you're just bothered with having to wear something all the time, then you might want to consider surgery. In that case, I'd recommend seeing a subspecialist in urogynecology. We can help you. We provide options in surgery and how to treat this. In a separate video, I'll walk through the different surgical approaches for treating this type of leakage, but it is very successful, easy to undergo, and can have a big impact on improving your quality of life. If you have more questions, I recommend that you go to our website. We have on the website various information about how to treat urinary incontinence. The website's called thewomen'scenter.com. Midway down, if you scroll down on the website, you'll notice that there's an ebook that I wrote called A Woman's Guide for Urinary Incontinence. If you click on that, there's a significant amount of information that can walk you through ways of treating urinary incontinence. And I suggest you consider doing that, and tune back into my YouTube channel for more information.